Hi everyone, my name is Alyssa McEwen and I will be presenting on Behavioral Economics for the online course hsc6603. Before getting into the review of the article I chose, I wanted to provide a brief overview of behavioral economics. The topic is something that I hadn't really heard of before this course, so it was really interesting to learn about it. Behavioral economics basically takes into account the fact that people are irrational in decision making and make decision errors. There are several decision errors that were discussed in Module 10 lecture. A few of the errors associated with behavioral economics can include regret, aversion, over-optimism, and loss aversion, as well as present bias. Behavioral economics can be applied to behavior change using a combination of economic and psychological principles. I really enjoyed the photo that I provided here because it gives a nice visual representation of how we can think of behavioral economics. The article I chose to review is titled Using Behavioral Economics to Encourage Parent Behavior Change, Opportunities to Improve Clinical Effectiveness. The article was written by Jensen, Buttenheim, and Fix, and it was published in 2019. I would like to preface with the fact that this article doesn't necessarily discuss a specific study or intervention that was implemented using behavioral economics. For this reason, it doesn't allude to a specific behavior change. It just provides examples and suggestions in which behavioral economics can be utilized with key strategies to influence the development of interventions relevant to health concerns in a pediatric setting. I chose this article because I would like to work with families and children in a clinical setting, and so I wanted to explore that area a little bit more. Essentially, this article highlights ways in which behavioral economics can be utilized in a pediatric setting to influence behavior change among parents that benefits the health of the child. The authors emphasize the use of 4 key strategies to promote parent behavior change. These strategies are listed here, and we will explore them in greater detail shortly. The author's suggestion related to behavioral economics in the pediatric setting takes into the consideration the provider, parent, and patient triad. So it wouldn't be appropriate to translate strategies used in adult settings between provider and adult patient to the pediatric setting because there's a totally different dynamic there. Particularly, interventions would need to be tailored to consider this triad because parents make different health decisions for their children than they might for themselves. The ultimate purpose of this article is to suggest the use of behavioral economics in a pediatric setting to change parent behaviors that ultimately improve the child's health and health care. This article provides suggestions for interventions in this area because there is limited applications of behavioral economics, and the authors believe that pediatricians are in a unique position to influence behavior change in this way. Oftentimes, behavioral economics are used in adult behavior change and have been proven effective for various health topics. Smoking cessation programs related to physical activity, and medication adherence are common areas of study for the application of behavioral economics. One example of behavioral economics used in these areas includes a randomized trial of an employee wellness program that was related to smoking cessation. An incentive worth $750 for smoking cessation nearly tripled quit rates from 5% to 14.7%. In addition, a physical activity randomized trial intervention used a loss frame incentive that led to a 50% increase in goal attainment compared to the gain framed incentive. In this study, participants were provided the incentive payment upfront and lost portions of that amount when daily step goals were not met. This article repeatedly emphasizes that more research is needed in the parent approach of behavioral economics. The authors note that there is evidence to suggest that parents are more motivated to engage in behavior change when they are confident that behavior will improve the health of their child. There is also discussion in regard to omission bias and loss aversion in parent decision making. An example of this provided in the article is when parents make decisions related to vaccines. The potential harm that occurs when deciding to vaccinate, would be the commission, is less acceptable than the potential harm that would occur due to not vaccinating, which is omission. Essentially, the perceived harms related to vaccinating are viewed as losses and therefore weigh heavier than the potential harms from not vaccinating, which would be, of course, exposure to preventable diseases. This is where the pediatrician would be able to utilize behavioral economics to make sure the parent is fully aware of their options and the benefits or risk of vaccination in order to make the best health choice for their child. Areas in which behavioral economics can be more heavily applied in research to overcome decision-making errors in parents are breastfeeding, safe infant sleep practices, vaccine adherence, and nutritional lunch options. So, to provide a specific example of how the author's suggestions could be used to develop and implement an intervention, I've used vaccines as a potential area of focus. By utilizing key strategies outlined in the article, pediatricians and their settings could be used to influence parent decision-making in regard to vaccinating their child to improve the health of the child. One of the key strategies of behavioral economics discussed in the article is message framing. Message framing is important because the way the message is presented can significantly impact the way in which someone makes a decision. There's gain-framed and loss-framed messaging, specifically discussed in this article. The proven effectiveness of gain-framed messages are one reason in which the author suggests using this method to help parents understand what both them and their child can gain from participating in a specific health behavior. An example of a gain-frame message for participating in a vaccination for the child could be framed as, by choosing to vaccinate your child, your entire family could reap the benefits of not being exposed to preventable diseases, and your child will be protected. The second key strategy related to this article is the use of defaults. This was briefly touched on in our Module 10 lecture in regard to defaults related to being an organ donor when receiving your driver's license. So the idea that you'd have to opt out if you didn't want to be an organ donor. The authors describe the use of defaults as using presumptive language and taking the approach of having parents opt out of health behaviors for their child if they decide to. An important point made by authors is that individuals tend to stick with the default choice that is presented to them even if different options are available. So defaults don't restrict the parent from making a choice, rather it signals the appropriate health conscious choice. Defaults can be opted out of by parents who feel very strongly about a subject or health topic, but it is an additional step that they would need to take. An example, of course, in this situation would be vaccines, so they can opt out of having their child vaccinated. The article mentions that there have been meaningful increases in vaccination rates in clinical settings where pediatricians used opt-out styles rather than opt-in styles to communicate vaccine adherence. So one example of opt-out styles is referring to vaccines as routine by the physician or receptionist in the clinical setting. And in that situation, the parent would have to verbally opt out of the health-promoting choice and not adhere to the routine health action. The third behavioral economics strategy is enhanced active choice. This strategy aims to present individuals with a question in which they can respond yes or no without having to give it too much thought. Enhanced active choice can be used to highlight relevant benefits to taking the action or the losses related to inaction. According to the article, enhanced active choice can be effective for health actions that involve commitment and long-term rates of adherence. This can be specifically applied to vaccine adherence, which is not just a one-time health interaction or need. The article highlights a few benefits of an enhanced active choice by stating that it avoids procrastination by empowering the decision maker to actually make a choice. It increased perceived responsibility by having the individual commit to a choice. And it leverages loss aversion for the new opportunity by highlighting disadvantages of not selecting the preferred option. So, an example of using an enhanced active choice in this intervention would be having the receptionist or pediatrician ask the parent, would you like for us to schedule your child's next vaccine visit while you're here today? This is a simple yes or no question that would provide the parent the option to commit to a choice of keeping their child's vaccines up to date and committing to a scheduled appointment if they follow up with the answer yes. The last key strategy of behavioral economics that is recommended to be used in the pediatric setting is the leveraging of social forces. As we've learned in previous modules, social networks and relationships can heavily influence health behaviors and health interventions. Approaches using social leveraging can ultimately advance health decisions and outcomes by taking advantage of social forces. The article states that there is little usage of social leveraging in healthcare organizations, and that this is one area in which healthcare interventions can be improved upon. Specifically, to optimize health outcomes, the authors recommend that pediatric institutions sponsor adherence competitions or create simple platforms for peer support within their organization to motivate health-promoting parent behavior. An example of using social leveraging forces in a pediatric setting to increase vaccine adherence might include a visible sign in the lobby that highlights the number of children served in the clinic that have received their routine vaccinations. This is a simple way to advertise a fact related to the population that the pediatrics serves, but also creates a comparison opportunity for the parent sitting in the lobby. So there are a few limitations related to this article and this area of study. And as I've touched on before, there definitely needs to be more research efforts applied to the pediatric setting using behavioral economics. Most commonly, financial incentives have been used in adult interventions using behavioral economics, but it's not very clear on how those tactics can be translated into the healthcare system to specifically improve child health and health care. Another major limitation outlined in the article is that policies can get ahead of the science as a result of the limited research. And so you have to be aware of this when planning and implementing strategies related to behavioral economics. So limitations related to program development are to be of concern. Developers and researchers using behavioral economics in this setting would need to continuously obtain feedback from parents in diverse populations, and this can be extremely costly and time-consuming. In combination with the feedback, there is not a lot of research related to diverse populations and behavioral economics, so specifically those from lower socioeconomic communities, and this can lead to unintended outcomes and expectations. Another limitation is oversimplifying complex health issues or solutions using behavioral economics in this setting. Health education specialists must be able to appropriately identify life choices versus structural injustices or disadvantages. So it's a very clear line we might want to avoid crossing. These limitations are a reason why the authors of this article feel the need to provide suggestions and methods in which behavioral economics can be implemented in this field before a full intervention trial were to be complete. So this is something you need to take into consideration. So to wrap everything up, the authors of this article really believe that pediatricians are in a unique position to utilize behavioral economic strategies in a healthcare setting to promote and influence health outcomes related to the children they serve through behavior change in the parents. This article pinpoints that behavioral economics can be used as a tool to empower parents to make healthy decisions that benefit their child's health. And the key strategies are a way in which pediatricians can implement behavioral economics in their field. By combining the key strategies to promote health behaviors, pediatricians, researchers, and program leaders can support parent decision making to influence health outcomes. The use of behavioral economics in the pediatric setting has the potential to boost program effectiveness and ultimately improve patient and family health status. The discussion questions I have for you following this presentation are, as mentioned in the lecture, behavioral economic ethics could be discussed in great depth. Do you believe there is any ethical dilemma in equipping pediatricians with behavioral economic key strategies to improve a child's health? Why or why not? And secondly, as a health educator, in what way or ways do you think behavioral economics would be useful in your desired field or specifically in a pediatric setting? So that'll be all for my presentation. Thank you all for watching, and I look forward to our discussion to follow.